in charge for the London School.
Thank you very much. So, yes. So, London School, obviously I think a number of Thrive Fellows have benefited from visiting London as from visiting Cambridge, as we heard earlier. They've learned new skills, they've done courses, they've set up new collaborations, and this has been very mutually beneficial. But I think our main contribution as the London School is the fact that we have senior academic staff based in 4 of the partner institutions in Africa. So we have colleagues based at Makerere, at UVRI, at KCMC, and at NIMRI, not sadly at Gulu at the moment, but I'm sure we can work on that. And so these colleagues have helped with supervision, mentorship, writing collaborative grant proposals, many successful ones, and setting up new courses. So we heard from John about the Research Methods course, which our colleagues based in Wanzo set up in collaboration with NIMRI. We've heard from Sia about the MSc in Epidemiology and Biostats, set up at KCMC using teaching materials from the London School. There are a number of other courses, for example, the short course in statistical methods and a short course in immunology at UVRI, which our colleagues based in Entebbe have helped to set up. And then the DTMH, the 3-month DTMH course, which involves 6 weeks at KCMC, 6 weeks at Makerere, and provides free places for 20 African doctors every year, with priority given to those from Makerere and KCMC. So I think in addition to that, we have, London School has strong links with a number of other Delta's programs, and I think we need to think carefully in our renewal. You know, on the one hand, we could regard these people as our competitors, but I feel we should reach out to them and perhaps look at how we can offer complementary skills. So the first example, of course, is MESAU-MEPI, which focuses on immunology and infection, and Thrive and MESAU-MEPI have a very excellent collaborative relationship, offering many complementary training skills. In addition, at London School we have strong links with Amari, the mental health program, which I see is mentioned in this newsletter. So this is led by Dixon Chibanda, who is a member of London School staff based in Zimbabwe. We also have strong links with SACAPS, which is the Delta's program focusing on epidemiology and biostatistics. Jim Todd, who's based at NIMRI, leads from London School on that program. So I do think when it comes to our renewal, we should perhaps review whether we should be talking to those programs and working out how we can put in proposals which are mutually beneficial. And finally, on the issue of public engagement, so I'm not an expert on this, and I'm never quite clear. So on the one hand, you have public engagement, which involves going to talk to school children and so on, and to the general public, study participants. On the other hand, you have engagement with policymakers, how to get the results of our research into policy and practice. And to me, that is key, and I think at London School we have many good examples of this. For example, Dixon Chibanda, his Friendship Bench, this program for mental health of adolescents and young people, which has been successfully rolled out in Zimbabwe and is now being done in New York, for example, and in Amsterdam. So this is really a remarkable achievement. And the other example I'd like to mention is self-testing for HIV. This was a research project led by my colleague Liz Corbett in Malawi, showing that self-testing is acceptable, is accurate, and gets people into care quicker. And this has now been adopted as WHO policy and it's being rolled out in many countries. So I think that's all I have to say. On a minute, it's gone over.
Well, thank you very much. Okay, I guess I just want to thank all the speakers for briefing us on exactly where they are, and I think Thrive is thriving very well. The new grants, capacity has been built, infrastructure has been done, research administration and policy guidelines have been established, the mentorship program has thrived, career progress has been seen, publications, and there's a good visibility of Twitter. Again, please remember the handle and say these nice things so that we can get them on social media. We'll take a short coffee break and then come back to here. Because we heard most of the achievements, when we come back, we'd like to hear the challenges and how we could help in improving those challenges as we look forward to Thrive 3. With this, please you're invited to coffee. We'll take just 15 minutes so that we can catch up with time.